Alright guys, now we're going to move on to hazardous recon. I know I have a bunch of writing here, so I'm going to go ahead and explain what I have going on here. What I like to do first is I like to basically look at what my doctor ordered, and because in this case it's given to you in a slightly different format. This order here basically tells you that for every kilo, the patient is to receive 0.05 milligrams. So what I did right off the bat is I converted my weight into kilos. When I did that, I got 80 kilos, and then we multiply by the 0.05 milligrams, which is what I did here. And then that tells me what my doctor actually wants this patient to have, okay? Then I moved on to figure out, okay, well, since this is a reconstitution problem, I need to figure out how to reconstitute my 4 milligram vial to obtain the 1 milligram per ml concentration that it's asking for. So again, you put the total strength of your vial, which is 4 milligrams, over the concentration, 1 milligram per 1 ml, and we get 4 mLs. So I'm going to need 4 mLs of diluent. Then I move on to the drug part. Okay, so how much drug am I going to need? If you recall earlier, I determined that my patient's going to need 4 milligrams. So 4 milligrams is on top, and then I divide that by my concentration, 1 milligram per 1 ml. And you get 4 mLs. These just so happen to be the same number. So is it always going to be like that? No, absolutely not. Okay, now I did put some notes for me down here, like I like to do. I did remind myself that I need to use negative pressure. And then I also wrote down the amount of air that my syringe is going to need to have, specifically the syringe that I'm going to be using to withdraw the drug up. Okay, so it looks like I did 4 multiplied by 75%, that gave me 3. So the syringe that I use for the drug is going to have 3 mLs of air. The syringe that I use for the diluent, since it is a diluent, it's not a hazardous product, I can go ahead and have 100% of air in that one. Remember, the 75% rule only applies for the hazardous closed system products. Okay, so let's go ahead and get started. I have all my supplies here. I'm going to start by spraying my gloves. Let those dry. And now once your gloves are dried, you go ahead and saturate your paper towel, which I technically had already done, so kind of cheated there, sorry. And you start wiping off your supplies. That bag's a hefty one, so you gotta be careful it doesn't slip out of your hands. One thing that I do want to point out for those that have probably noticed that first I put my vials, sometimes I put my IV bag in, then my vials, then my syringes, or sometimes I do it the other way around. There's no right or wrong way of doing that, as long as you always follow the airflow rules. So you can put your vials in there first if you want, then your IV bag, then your syringes, whatever it is that you want to do, okay? As long as you never block the airflow. That's just the key thing here. So I'm going to go ahead and take the caps off of my vials towards me. And I'm going to go ahead and wipe off my alcohol pads here, one at a time. Wipe the powder towards me. And then wipe off the rubber shepherd to my diluent towards me. So now I'm all set up. I've been coming in and out of the hood, so just like we've been doing. You spray your gloves, allow them to dry. So now my gloves are fairly dried. I'm going to go ahead and grab my first syringe. My first syringe I'm going to use for the diluent. Remember, diluent is not a hazardous product. That's why I'm going to have 100% of air inside of my syringe. So the diluent, we determined that we were going to need 4 mLs. So that's what that has. Then the second syringe I'm going to be using for my actual drug. 75% of 4 mLs is 3. So that's why that one's at 3. So I'm going to put that guy down. I'm going to bring my diluent towards me. Uncap my needle. Apply pressure within the bullseye, 45-degree angle, and then go straight in. Do your upside down peace sign, and we flip it to the side. Remember, we don't fully flip it, okay? Leave it at this angle here. Because again, this is the vertical hood. My air is coming from the top to bottom. Since this is the diluent and it is not a hazardous product, I can use positive pressure. Now you have to completely have it straight up so that you can clear your air bubbles. Remember, this is where you have to do this fairly quick. You QS to the desired amount, lock it in place, flip it to the side, and withdraw air out as you're coming out. My pharmacist is going to come and grab the diluent from me so that I don't have to exit the hood, because we shouldn't do that once we've started the compounding process. And now I'm going to go ahead and cap my needle. And yes, I am recapping this one. Again, a diluent is not a hazardous product, so we are allowed to recap the diluent. Next, I just cleared my air bubbles. I'm going to pull back and then push up to make sure that I do indeed have 4 mLs in here. And you may have seen a few drops here at the top. Technically, again, this is not a hazardous product, so that's okay. Now, if you have medication gushing out of the top of your cap here, that may be a little bit of a problem, okay? So once you make sure that your measurement is accurate, you go ahead and uncap. You bring your powder towards you. Again, since we are going to be puncturing this guy twice, you want to puncture it within the bullseye, but you want to puncture it about this point here the first time. The second time you puncture it, the furthest away, which would be this point here. Okay? I'm going to go ahead and do that. And again, I'm not going to fully flip this guy, so it really wouldn't make sense. And yes, I am shoving the liquid in. So technically we're using what we call positive pressure. At some point you'd have to flip it completely straight up. Same thing, when you're coming out, you're going to withdraw air out. Since this needle touched, it basically diluted my hazardous product, I cannot recap this guy. So now my pharmacist is going to come and take this from me and dispose of it. So now I'm going to go ahead and swirl this guy to mix it. And these tend to mix fairly quickly, so that's a good thing. We don't have to wait forever. So again, if I basically turn it slowly, I can tell there's no actual powder residue on the bottom, so we're good to go. Now I'm going to uncap my second syringe, bevel up. This is where I punctured it the first time, therefore I'm going to puncture it here the second time. Upside down peace sign, you flip it to the side, not completely, about midway. And I'm going to start using what we call negative pressure. So I'm going to pull back and release. Pull back and release. So from here my syringe is pretty much filled up, which is good. So I have to hold it straight up so I can clear my air bubbles. And now I'm going to QS to what I need. We needed 4 mLs of drug. That's 4 mLs there. I'm going to flip it to the side and withdraw air out as you're coming out. My pharmacist is going to come and grab this vial from me. And my pharmacist just watched me lock my syringe in place. So that's how basically he knows that I, yes indeed, have 4 mLs of drug inside of this syringe. So now I'm going to go ahead and apply pressure here. And inject all of my medication in the bag. My pharmacist is going to once again come and grab this syringe from me. We're going to mix the bag, cap the white port. We're going to clean the IV bag with 70% isopropyl alcohol. Once that's dried, we place a hazardous label, the patient label. We place this bag into a hazardous bag. And then once we seal that hazardous bag, we put it into a transportation tote. And then off we go. We can go ahead and deliver it to the nursing unit. I do want to show you what that hazardous bag looks like. The hazardous bag looks like this here. As you can tell, it says caution chemotherapy drug. So that's what it'll look like, okay? And the facility that you work at may have one that looks slightly different. That's okay, as long as it says that it is a chemotherapy drug, all right? And then once you have this all set to go with your medication bag in there, that's what you stick into the transportation box. And you're ready to go.